Welcome, everyone. Please continue to introduce yourself in the chat box as we get started. My name is Scott Polizzi, and I work on the Evidence and Learning team at EDC on a program called the Leading Through Learning Global Platform, or LTLGP, as we'll refer to it for the duration of this meeting. We are excited to share with you the results of research from USAID and the University of Auckland on effective tools and approaches used in education during the COVID-19 response with implications on resiliency. I would like to remind everyone that this webinar is being recorded. The recording will be available on the LTLGP YouTube channel in a few days, and we'll share that information with those of you who have registered. So please take a moment to review these webcast norms and reminders on the screen. Closed captioning is available via the CC button at the bottom or the top of your screen. And please be sure to stay muted with your cameras off while the speakers are presenting. And then I would like to quickly review the objectives for today. The first is to understand the values and limitations of globally produced guidance and tools. And then the second is to gain insight on the promising practices or interventions, and then how we can access each of these products in our own work. Those are the three things we would like to achieve today. Now I'd like to hand it over to Julia Jonah, who's a Senior Advisor for Education and Crisis and Conflict at USAID, to get us started. Julia, would you mind?
Sure. Thanks so much, Scott. And it is a pleasure to be here with you all today. And as we all know, the educational experiences of learners and teachers all around the world have significantly been disrupted over the past years, both by the implications of the COVID-19 pandemic, as well as other factors like conflict, crisis, and climate-related interruptions. Governments and partners around the globe have been navigating how to mitigate learning loss and to sustain learning outcomes through these education disruptions and school closures. And many are really grappling with the long-term struggle of how to engage, or in some cases, re-engage children and youth in education. So during the COVID-19 pandemic, USAID worked with partners to help rebuild education systems. We also helped to mitigate learning losses, prepare for heightened uncertainty in global education, and tried to equip education actors and institutions to be increasingly resilient. USAID's efforts focused on, number one, ensuring a safe return to learning, especially for the most marginalized, and number two, building more resilient and equitable education systems and societies. So within the Center for Education, we have identified 6 priority areas for education response during COVID-19. These are: 1, partnering with ministries of education to safely and responsibly reopen schools. 2, expanding the reach and accessibility of distance learning. 3, providing psychosocial support and access to protection services. 4, building emergency preparedness and response capacity. 5, institutionalizing remedial and accelerated education. And 6, engaging youth and higher education institutions as leaders. And after 2 years of pandemic response, amongst the multitude of different resources, research, and guidance that has been produced, we recognize that there still is a dearth of evidence-based examples of education responses that have allowed children and youth to remain engaged with and participating in learning. And so for this reason, USAID is utilizing this opportunity to learn from the pandemic and support policy and program reforms that transform education systems to be more inclusive and responsive to the needs of all learners and educators. The intention of this research is quite timely, and we've been able to collectively learn from what has been done to date in response to the pandemic, and with that effect, in the hope of leading towards more contextualized, evidence-based, and coordinated response efforts. By learning from our experiences and evidence, we know that we'll be better able to build back better and to use our learning from this current crisis to better respond to future ones that we will inevitably face. So together with the Education Development Center, we commissioned a team of researchers from the University of Auckland to conduct this research. And it's my pleasure to now hand it over to them to elaborate on and provide more details.
Thanks, Julia. Hi, everyone. My name is Ritesh Shah, and I'm a senior lecturer in comparative and international education at the University of Auckland. And I'm also the principal investigator for this research. As Julia started to introduce, this research set out to explore both the scope and range of resources, tools, and guidance generated during COVID-19, as well as some of the promising interventions and practices which were either developed or reshaped or pivoted in some way to respond to the pandemic, and specifically in seeking to mitigate learning loss and sustain learning outcomes. To go into a bit more depth on the first of these objectives, we examined the scope and range of resources, tools, and guidance generated during COVID-19. And this included seeking to firstly map out the range of material that has been produced, and then secondly, to understand the degree to which they are being used and how to shape responses to the pandemic. In doing so, our aim was to identify what additional resources, tools, and guidance might be needed, if any, and in what form, to better shape responses to the pandemic or other shocks and stressors facing education systems moving forward. The intention was also to identify where further socialization of existing COVID tools, guidance, and resources may be needed, or how within LTLGP, and how some identified gaps in either the guidance materials or evidence base might be addressed. In seeking to explore this theme, we conducted a mapping followed by a sector-wide survey, the results of which my University of Auckland colleague Kayla will share with you in a moment. So to start, I would like to invite all of you to engage with us for a second and pop into a chat one of your most used or most favored resources that you ended up using to inform your pandemic response. These can either be resources internal to your organizations or externally developed resources, such as USAID's Returning to Learning Toolkit or a UNESCO or CASEL resource, for example. This might also include locally developed resources. Alternatively, maybe you didn't use any resources at all in your response, in which case also let us know that. We received that response many times in our survey. I'm going to give you a minute to pop your resources into the chat and to have a look at some of the other types of resources others used. My colleague Kayla is then going to pick up on some of your responses in a moment. So please take 30 seconds now to just type in the chat a resource that you used during the pandemic. Thank you, Craig. Always the hardest to go first, so I encourage others to jump in. Thank you, Elisa. Thank you, Sabrine. Julie, Janelle, Helen. Excellent. I like how there's increasing momentum in the resources that people are pulling in the chat. And we can see that there's quite a diverse range of resources that are being highlighted here. And this actually aligns very well with what we found in the results of the survey, which Kayla will share momentarily. And feel free to keep adding these in because Kayla would like to come back to some of what you put in the chat in her part of the presentation. But I'm going to now move on to talking about the second aspect of our work. And that was to identify promising interventions and practices which were developed or reshaped to respond to the pandemic, In this case, when we talk about promising practices, we're defining them as those which enable learners to remain engaged with and participating in learning opportunities throughout the pandemic, which address the psychosocial impacts of COVID-19, and/or which sought to minimize or address learning loss in some way. What's important about these practices, though, is that they developed an evidence base around their work, which indicates the impacts of their actions. We also sought out interventions which had moved beyond immediate response measures and were contributing to strengthening education systems more widely. My other University of Auckland colleague, Julie, will share some findings from this component of the research with you in a moment, particularly focusing on what allowed these responses to not only address the acute needs of learners, schools, and communities affected by the pandemic, but to also strengthen the system to future shocks and stressors. This is what USAID deems as the objective of resilience-focused programming. And today, we hope to illustrate how resilience is both demonstrated, but also functions, using examples from the COVID-19 emergency to do so. But for now, I'd like to ask you to enjoy hearing about some of the findings of this piece of research. What we're going to do is after each component, there will be an opportunity for questions and answers. So feel free as we move along to drop your questions in the chat, and we'll answer as many as possible. At the end of this webcast, I'll then return to provide insights into what we've learned through this research in relation to USAID's Education and Resilience Framework, the link to which is now in your chat.
Great. Thank you very much, Ritesh. My name is Kayla Bover, and I'm a senior researcher for this work with the University of Auckland. Today, I'm going to share a little bit with you about our key findings about the tools, guidance, and evidence that were developed during the pandemic. So the first step of our process, as Ritesh mentioned briefly, was to develop a repository of resources to support education stakeholders during the pandemic. In our search for these resources, we looked at many common repositories like INEE, EduLinks, World Bank, and UNESCO. And we mapped all of the resources against USAID's 6 education priority areas, which Julie already listed for you, and which you can see again on your screen now. In total, we mapped 222 resources, and those include policy guidance and advocacy documents, technical tools and guidance, and evidence on the impact and responses to the pandemic. We also mapped resources to support a cross-sectoral response, for example, WASH in education institutions, and we did this across the entire education spectrum, so from early childhood education through higher education in both formal and non-formal settings. One important limitation to note, though, of this repository is that even though there are some resources in multiple languages, it is a bit heavy on the English dominant side. In the repository, you can filter through the resources to find exactly what you need. This could be done, for example, by document type or by audience, by topic or geographic scope. So this means, for example, if you're searching for something specifically on advocacy around distance learning in Africa, the repository could help you find something even that specific. And although we only included resources developed in response to COVID, many of the resources are still relevant to other emergency situations. And now if you look into the chat, you can access this repository on EduLinks, and you'll see the link in there now. Okay, so after we created the repository, we conducted a survey with 259 USAID staff and partners. Some of you may have actually participated in this survey, which would be great, and thank you very much for doing that. This survey helped us to look at a few things. First, we wanted to understand which tools, guidance, and evidence were being used and how during the pandemic. We also wanted to understand what else might be needed. And then finally, we wanted to understand where additional dissemination and support for utilization would be helpful. As you can see in this table, about between 1/2 and 3/4 of respondents in each of the 6 priority areas said that they used at least one of the global resources that we mapped. And that to us suggested a fairly high uptake of these resources. And some of the most commonly used resources you can see listed on your screen. Those included in the survey, the Framework for Reopening Schools, which was developed by UNESCO and others, as well as USAID's Initial Insights document. And as I was reading through the responses you put in the chat, I saw some of these same resources being used, but I also saw a lot of the other resources that we had listed in the global mapping. So the INEE guidance around condensing a curriculum and some other resources by UNESCO and USAID. So then for folks who said that they did not use any of the global resources that we listed in the repository, we asked them what else, if anything, they used. And for most of the priority areas, the majority of respondents said they did use other types of tools, guidance, and evidence. And again, as I was looking through some of your responses in the chat, this is where I really see a lot of overlap with the results of the survey. So as you can see here, respondents sometimes listed other global resources, but many really focused on localized and context-specific resources. Those included Ministry of Education guidance, rapid assessments, education strategies, resources from curriculum development centers, and much, much more. Some respondents, like many of you who wrote in the chat, also used webinars, websites with curated resources, and academic publications. And a really interesting finding, which again, many of you did mention, was the use of social media platforms, things like WhatsApp or even SMS or different blogs and even webinars and different trainings too. What we found in this part of the research was that many of the respondents used resources that met their immediate need. They were context specific, they were available when they were needed, and they proposed feasible solutions that could be implemented now. So next, we asked respondents how they use these resources. This graph shows that most of the respondents used resources in the design or adaptation of education activities. And one example of this is to learn about a specific type of education intervention that might help in their response. We also saw a lot of folks using resources for capacity development, which included understanding how others are responding to the pandemic. We noted some interesting differences between the different respondent types. So for example, USAID missions more often used resources to inform decision-making around funding and policy. Ministries of Education often used resources to better understand the impact of the pandemic. And NGOs often used resources for design, implementation, and capacity building. Finally, we wanted to understand what some of the strengths and limitations of the resources were and what else might be needed. Overall, participants generally saw a useful resource as one that is relevant, user-friendly, and timely. And our research shows that the most important feature was relevance of the resources. This meant both relevance to the context as well as to the specific target population. This was especially true for respondents working at the national level and those focused on design and implementation. And one important component of relevance was whether the proposed solution could be feasibly implemented given the material constraints of the context. Other important features were if the resources were available at the right time during the pandemic, if they were free to use, whether they were flexible and adaptable enough, and if they were available in a language that respondents could use. And interestingly, we learned that nearly 1 in 3 respondents actually did not know where to search for the resources that they needed. And this was a major limitation for USAID missions, NGOs, and Ministry of Education officials alike. And other respondents also reported being overwhelmed by the number of resources available, and then that made it difficult for them to decide what to use. So taken together, the survey and the mapping highlight a few key considerations. First, we see that there is a need for better curation and socialization of existing resources. We know that many tools and guidance already exist, but folks can't always find them, access them, or know how to use them. So this really highlights the importance of not necessarily creating new resources, but rather focusing on dissemination and supporting uptake and use. Second, when new resources do need to be developed because there's an important gap to fill, they really need to be developed in partnership with local stakeholders, and they need to be contextually relevant or relevant to the specific target populations. And third, it is important to remember that the concept of resources might mean a whole range of different types of supports, from more formal ones like publications and webinars, to more informal ones like networks, social media, blogs, and word of mouth. So, and this was really highlighted again in the chat responses you all shared with us. And it really indicated to us that the development and dissemination of resources need to account for a wide range of modalities. So these findings and recommendations will be available in the full report by the end of the year. And so please just keep an eye out on EduLinks for that to come out. And I'll pause for just a second to see if there are any questions about the research or about objectives 1 and 2, both the mapping and the survey. So go ahead and take a couple more minutes to type any questions you have into the chat. And while I'm waiting for any questions to come in yet, I wanted to just kind of go back to a point that we really wanted to stress. So as I mentioned, we did really focus in the repository on resources that were developed during the pandemic. But as we're sort of exploring in our synthesis report, and as we explore in the case studies that Julie will talk a bit more about, we look at these resources as having much more longevity than that. So really looking at the relevance of these resources beyond the pandemic. And it was very clear in looking at some of these resources that they were developed with that intent. I know that the USAID resources absolutely were developed with that intent, that they have much more lifespan to them beyond the pandemic. So we hope that the repository itself will actually be quite useful, beyond our immediate and even, early recovery responses from COVID. All right, and I don't see any questions coming into the chat just yet. Don't be shy, but I will turn it over to my colleague, Julie. And you can continue to think about any questions you have, and you can put them in the chat, whether they're for Julie, Ritesh, or myself. Thank you very much. Over to you, Julie.
Thanks for that, Kayla. Hi, everybody. My name is Julie Chinnery, and I'm a senior researcher on this work with the University of Auckland. As Ritesh noted earlier, the final section of our research explored a range of education practices which were either pivoted in response to COVID or developed in response to COVID. And in particular, this research sought to identify promising practices, which Ritesh defined before. And these are practices which really sought to minimize or address learning loss in some way. So to identify some promising practices, we actually put out a call to across the learning networks of USAID's Leading Through Learning global platform, to which we received 79 responses. And I know that some of our partners are online today. I know that Ellen's there and Janelle and colleagues. So great to see you online. From all of the 79 responses, we identified 9 responses in particular, which demonstrated promise through their COVID response and, importantly, which developed an evidence base around their work, which could demonstrate the impacts of their actions. So we grouped these 9 into 3 case studies. The first case study you can see on your screen was around providing PSS, a psychosocial program, psychosocial support, social and emotional learning, and access to protection services during COVID-19. The interventions that were identified under this case study were implemented by Population Council in Kenya, Amal Alliance in Bangladesh and Greece, and STIR Education in Uganda. So I'll give you a moment to just have a quick look through the briefs of each of these interventions, and then I'll talk you through the other case studies as well. The second case study you can see on your screen there is one in which we explored implementation of accelerated and remedial education during the pandemic. And the identified interventions that we looked at for this one were World Vision in Cambodia, Ghana, and Zimbabwe, FHI 360 in Ghana, and Geneva Global in Uganda. Again, I'll give you a moment just to have a look through the briefs of each of these three really interesting interventions. And lastly, the third case study then that we had a look at explores the engagement of youth and higher education institutions in the COVID-19 response. And I know that some of these partners are also online today. So the partners in this case study included Educate in Uganda, School the World in Guatemala and Honduras, and AIR and Redle in Central America and the Caribbean. Again, take a moment to have a quick look at these interventions, then we can talk a bit about the promising practices of each. In fact, you might actually recognize some of these interventions from your own context of operation. And please feel free, if you have any questions directly for the partners implementing partners that you see here on your screen, feel free to also drop those into the chat, because the partners are ready to respond to questions in the chat if anybody has any questions for them. Okay, so finding across the case studies focused around four key promising practices, which allowed these interventions to not only absorb the impact of COVID, but to actually adapt to it and to even grow through it. And in most cases, contribute towards systemic change and broader systemic resilience. So we'll have a quick look now at what they did, noting that although these promising practices were identified during COVID, as Kayla just said about the resources, most are relevant to practices in other contexts too. These are not just pandemic specific responses. So as I move through, as we did with earlier presentations, please feel free to drop any questions in the chat, and we hope to respond to as many as possible. So then the first key promising practice that we looked at was around the importance of identifying, leveraging, and then building on existing networks, actors, institutions, and expertise, rather than introducing new networks, systems, and expertise into the different contexts. So evidence from several of the interventions highlighted that in a time of crisis, the capacity to quickly pivot or reprogram existing activities depended on actors or partners' capacity to actually identify and leverage pre-existing partnerships. For example, with national education authorities. So in this case, we saw Population Council in Kenya, who mobilized its long-standing partnership with the Kenyan Ministry of Education at both national and subnational levels to quickly launch its 4Ts intervention for pregnant and parenting girls. Similarly, FHI 360 also capitalized on its long-standing partnership with the Ministry of Education in Ghana to support it to rapidly launch its national reading radio program. In both of these cases, Population Council and FHI 360, the existing trust between the partner and the ministries of education allow the responses to be prompt and to address gaps in the national education response, which was highly effective. Other partners then leveraged existing partnerships with community level stakeholders in their responses. So for example, we saw that Geneva Global was able to mobilize existing relationships with community facilitators, with caregivers, with local education authorities to pivot its Speed School initiative to become a hybrid delivery learning program in Uganda. And we saw that School the World also drew on existing, but also new partnerships with schools, communities, and universities to develop and implement a peer-to-peer tutoring program for primary age learners in Honduras and in Guatemala. In both of these cases, School the World and Geneva Global, these community level relationships were important, especially in allowing the partners to understand the localized concerns around learning loss, and then to be able to launch effective and timely responses that had engendered community level support, which was important. So that was the first promising practice. A second promising practice then that we saw across the case studies was about the importance of experimenting and learning and then adapting based on evidence. And this was important, that evidence was being collected on which to adapt. So for example, we saw that STIR Education responded to the global push that we saw during COVID to better support teacher well-being during the pandemic, especially by experimenting from shifting from in-person training for government officials and teachers in Uganda to using a radio-based programming intervention to provide coaching and capacity development on stress relief and coping skills during the pandemic. Similarly, AIR identified a critical need during the pandemic to be able to remotely assist university faculty to continue to support their students' learning and well-being. So with the support of Red Leg, they developed a series of webinars which were piloted in Costa Rica and then scaled to Central America and Caribbean regions. In both of these cases, interventions were predicated on a willingness to use the pandemic actually as an opportunity to experiment and trial new approaches, and really acknowledging a need to fundamentally rethink these business as usual approaches. So interventions in these cases were responsive, were accessible, and were adaptive to identified needs. And being willing to experiment in these cases allowed these partners to really act rapidly to identify needs and emerging programmatic concerns. The third promising practice then that we noted across the case studies was around thinking beyond the immediate response from the start. So really thinking the pandemic pushed partners to fundamentally rethink how they can best support learning and well-being in a time of crisis, while also working to strengthen and transform education systems beyond the pandemic, which is often referred to as building back better. So for example, as a grantee of UNHCR's Humanitarian Education Accelerator program, Amal Alliance was able to build internal capacity to mobilize a collection of strategic partnerships to support implementation of pilots in Bangladesh, Uganda, and in Greece. And these partnerships provided support to Amal Alliance in the immediate response, but then also working to support processes for designing and implementing and gathering evidence for further scaling and system strengthening beyond the emergency response. And then a final promising practice, which we saw across the case studies and across all of the 9 interventions, was around partners' prioritization of local needs and priorities. So many of the interventions were effective because they designed and adapted in ways that responded directly to the identified needs and priorities of the target populations in the locations that they sought to serve and the systems that were already operating within these contexts. So, for example, then we saw World Vision in Cambodia and Ghana and Zimbabwe, who sought to fill a gap in the national response for children whose low literacy levels would not be sufficient for these children to access the home-based learning programs that were being rolled out by the Ministries of Education at a national level. And for in this case, they really targeted children who were at increased risk of dropout or at risk of significant learning loss. Additionally, then, Educate explored various ideas and consulted with their own staff and students and others in location to identify ways to deliver Educate's core experience that allowed youth in their programs to achieve their objectives. In both of these cases, partners designed programs responding directly to local needs identified by the populations themselves. Both approaches, in this case, acknowledged that responses need to be locally designed or co-designed, locally owned and locally driven to ensure relevance, reach, and impact, particularly in reducing the risk of participant dropout from their programs. So they're the 4 key promising practices that we saw across the interventions and across the case studies. I'll pause at this moment to see if we've had any, to see if anybody has any questions. And keep in mind that you are welcome to drop a question for me, which is about, say, the promising practices that we saw emerge through the research, or questions for any of the partners, the implementing partners of any of those interventions. I would have loved to have given much more details about each of the interventions but time doesn't allow today. But the reports, we have our 3 case study reports coming out very soon, hopefully before the end of the year, where you can read much more detail about each of those 9 interventions across the 3 case studies. So if anybody has any questions for me or a question for Kayla, now is the time to pop it in the chat. I'm happy to respond. I will also reiterate a note that Kayla said earlier, and which I think we'll hear strongly from Ritesh in a moment, and that is about the findings that that have emerged through this research. We see are very relevant beyond the pandemic, which is critical, isn't it? And one of the key strengths being that responses then are relevant not only in the immediate in an immediate emergency response, but also responding to a longer trajectory of support into a recovery response. Okay, I see a question here from my colleague Ritesh. If these practices were locally owned and driven, how did or do they then move to strengthening the education system more widely? I guess here then, it's definitely about what we saw in one of the promising practices about drawing on those existing partnerships, and we saw commonly that partners aligned themselves very closely with ministries where that was relevant, but also with national level policy that was being developed to ensure that that all interventions were aligned with localized needs, which was important. But also then we saw a lot of the partners who aligned themselves with community level actors. So in some cases, this was civil society groups, but in other cases, this was also with local level government actors, and also often with parents and caregivers themselves, and drawing on responses from the children themselves and youth themselves to find out what it is that they are identifying as their own needs. I see another question here. The 4Ts intervention in Kenya is good. How were the curriculum developers involved in this initiative? Great question. Thank you, Anne. And I do think about 1 minute ago, I saw our Population Council Kenya colleague emailed me quickly to get the link to join this webcast. So I'm not sure if George actually made it online, but I think he would be best placed to respond to that in more detail. So we can ask him to do that afterwards, and we'll put his answer on the website with the link to the recording of this webcast. But in brief then, the curriculum developers were involved in this initiative through, I believe it was, they brought in, Population Council Kenya brought in government partners as well as their own technical experts, who then drew on existing research that they'd collected about specifically on the target group that they were targeting, which in this case was pregnant and parenting girls in Kenya. And in that way, they developed, it was a co-development of materials. They didn't necessarily develop curriculum, but it was more about information campaigns, and then about actual action, direct one-on-one action to ensure that the families of these target groups were informed about the specific policies that they could draw on to get back into school. I see there's a final question there, but I may have to, if we have time, I'll come back to your question, Sabrine, afterwards, because at this time we do want to just draw back then all of the findings that Kayla and I have presented back to what does this mean at a grander level. So at this point, I will hand over to Ritesh, but may be able to get back to your question later. Thanks, Sabrine.
Thanks, Julie. And it's good to see questions starting to come in. And we encourage you to keep those questions coming in. If we don't manage to get to some of these questions at the end, we will make sure to try to respond to those questions following this webcast. So during this last part of the webcast, I'd like to kind of now move beyond the pandemic, noting that despite COVID-19 receding as a immediate concern for many, we argue that there are important lessons to be learned from the way the education community has responded to the impacts of this global crisis. In doing so, what we'd like to do is to make some specific connections back to key messages within USAID's Education and Resilience White Paper, and specifically to think about the implications of our research in terms of what does it mean then to program with a resilient stance. Beyond this, though, I also want to highlight how much of this, what's in this white paper, is also resonating with a number of recent USAID priorities, specifically in terms of supporting local capacity development and programming across the humanitarian development continuum. Before we do that, though, I'd like to again invite all of you to put in something into the chat. And what I'd like you to reflect on are themes that you've heard emerging during the two presentations from Julie and Kayla about good or promising practice in crisis response and in building resilience. So in other words, what do you take away from some of the practices that we've highlighted in terms of what does it mean to program in a way that supports learner well-being, learning continuity, sustain learning outcomes, and build resilience? And I'd like to invite everyone to just pop into the chat one or two themes that you've heard emerging from the discussion so far. So please go ahead. Thank you, Julie. I always appreciate you jumping in first. Any other themes besides localization? Cornelia, yes, working with local partners and existing partners. Leveraging existing resources. Thank you, Gwen. Yep, planning for the long term. I think this idea of kind of thinking beyond the immediate and thinking about how to strengthen systems. The importance of localization. Thank you, Melissa. And we're going to come back to some of these points. And these are exactly, and please keep keep putting these in. And it's lovely to see that some of the things that you're picking up on are exactly the things that we are starting to highlight in our synthesis as well. So with that, I'd like to just now share our thoughts on this. So USAID's Education and Resilience white paper indicates that throughout the program cycle, there are a number of important questions that need to be asked when designing, implementing, monitoring, and assessing responses in both humanitarian and development context. These questions are captured in the visual that you can see. I'd like to walk us through these questions using what we've learned from our research. We're going to start with the green and gray boxes, resilience to what and resilience for whom. So in terms of resilience for whom, in any context, we can see that there is always the risk of shocks, for example, a health pandemic like the one we've just experienced globally, but that these occur along long-standing stressors such as poverty. The resulting interactions have varying severity and impact on segments of the population, and that will put some learners and communities more at risk than others. A critical starting point, as we've seen across these evidence-based promising practices, is to shape any response based on evidence of who or what needs support, in what form, and why, with a focus on understanding those who are most vulnerable to a certain set of risk factors. In terms of effective responses which supported the strengthening of systems, did so by not only addressing the immediate need, though, in other words, not just the short-term issue, but also identified ways to support either organizational and institutional approaches to working and responding to a crisis, and or the capacities of these stakeholders to improve their preparedness to future shocks and stressors. For example, strengthening data management systems, improving digital infrastructure and capacity, and institutionalizing more flexible ways of education delivery. In doing so, they began to address some of the underlying causes and challenges precipitating the issues which specific learners, educators, and communities encountered during the pandemic. In other words, the factors leading to the increased vulnerability to the pandemic in the first place. So ultimately, when we answer the question of resilience to what, this focus on reducing the vulnerability of an education system to a range of stressors and shocks should always remain at the fore and is equally important in both humanitarian and development programs. The aim is to ideally ensure these systems are able to quickly pivot and respond to any sudden onset emergency, and to ensure that in such times, there is no backsliding on previous gains in learning and well-being. This now brings us to our next question, resilience through what? The promising practices of these partners began by identifying and strengthening existing assets, resources, and networks within the education system. What made many of these interventions effective was that they had a good awareness of the local system's strengths and capacities, the relationships between these actors, and the rules, incentives, and norms which could incentivize or inhibit change. Based on this, partnerships, some new, some existing, were bolstered and strengthened, and with a high degree of intentionality in ensuring that the capacity development work that was undertaken had a level of ownership and commitment standing behind such efforts. Such an approach highlights two key points from USAID's recently released local capacity strengthening policy. Firstly, the policy stresses the need to start with the local system and to align action with local priorities, and to appreciate and build on local capacities. Secondly, it emphasizes the importance of strengthening diverse capacities through diverse approaches. This now leads us to our final question, resilience of what and to what end? The outcomes and objectives of all 9 interventions remain grounded in a commitment to maintaining and enhancing learning and well-being outcomes. Yet all partners recognize the importance of significantly pivoting action and reconsidering their typical entry points, interventions, and even target groups due to a quite drastically changed context and set of needs. This was enabled by a willingness to experiment with new solutions to continuously reflect on the impact of actions undertaken, and to integrate learning into future efforts. Ultimately, it is this adaptive management approach which supported and strengthened the resilience of the education systems targeted by these 9 interventions. In doing so, these interventions highlight several priorities within USAID's education policy, specifically the importance of testing new technologies and seeking new partners, experimenting with collaborative forms of activity design, and embracing adaptive and flexible implementation mechanisms. In doing so, these promising practices highlighted how these approaches can strengthen education systems' resilience. So to conclude, there are 4 key elements of what we believe is required in a time of a large-scale acute shock turned stressor event, such as COVID-19, to support and strengthen learning and well-being. These are the ones that many of you have been pointing out through your chat responses. Collectively, these 4 dimensions contribute to supporting and strengthening education systems' resilience. By doing so, they better enable education sector-specific and wider development outcomes of interest in partner countries to be sustained and further advanced. Ultimately, this is a concern shared by all across the humanitarian development continuum.
All right. Many thanks, Ritesh, Kayla, and Julie. This brings us to the end of our webcast today. Thank you to all of you who participated, researchers and participants alike. Thank you for asking questions or for your contributions. This webcast has been recorded and will be available on the Leading Through Learning Global platform on our YouTube channel, and we'll communicate that in the next week or 2. We'd love to stay in touch with you and have this be the start of a dialogue around these important topics. So please sign up for any of the USAID Learning Networks or regional hubs at the link in the chat and stay up to date on the latest research, events, and ways to engage around COVID-19 responses and other dimensions of education. If you want to continue specifically on the conversation of COVID-19 and responses in education, our colleagues at the Education in Crisis and Conflict Network are hosting an event on learner mental health and return to learning, which will be held in January, and we would welcome your participation in that. So please keep an eye on the ECCN LinkedIn group, that's the Education in Crisis and Conflict Network, and their LinkedIn group for more information. Finally, we'd like to just check in with you and hear what you've learned from today's webcast. So you should see a poll question pop up on your screen. If you could give a quick click on the polls icon at the bottom of the top of your screen, then we could maybe take 2 minutes or so just to get your feedback, and that will help us improve future offerings from LTLGP. Thank you all, and I hope you have a pleasant day.